Hi guys, and welcome to our latest Elevate discussion. And we'd like to introduce two brilliant people who I've been actually watching their journey for many years now. Andy Thomas and Dominic Smith. You know, thanks from Physiquipe. Thank you very much for joining us. Like I say, you know, these guys are fantastic at what they do. I've definitely had the privilege to be down and have a look at the products that they deliver, and you know, there's some fantastic stuff. So really privileged to have them on. So it'd be nice to hand over to themselves and let them introduce themselves.
Hello, Andy. Thank you very much for the invite. I'll introduce Dominic after me, but just to give you a quick background of what we do. So I'm director of Physiquipe. I set the company up just over 8 years ago now, which every time I say that, it still stresses me out of how quick time has gone since setting the company up. But I got into doing it because I was working for another company selling medical equipment, still into mainly physio sports science. And I could just see a lot of opportunities of different products that were out there, and I wanted to bring them into our portfolio. So I set Physiquipe up in 2012, and since then we're always looking for what are the best technologies that are out there that can really enhance obviously the clinician who's delivering the treatment for the patient, but also works from a business perspective as well, because we know that everything has to be paid for. So that's really my goal within the company, is being able to bring in innovative technologies that are going to genuinely add value clinically and financially. And then I started off, it was just me doing it, and then I was always wanting to building a sales force that actually could understand and relate with the customer. So I wanted to get someone who had that clinical background. So Dominic was the first person to join our clinical sales team, and he's done a really, really good job with being able to understand the clinical benefits of the products. And a lot of the time he's definitely got a lot of clinical questions for the products that I bring to the table, and will challenge me on them, which is great. But fundamentally, he can understand the challenges that the clinician's going through and be able to relate to that on a clinical perspective. But I'll hand over to Dominic and explain a bit more about what he does.
Yeah, so thanks for inviting us on, Andy. And so I'm a graduate sport and exercise therapist by background. So when I first met Andy, I was introduced to a lot of the equipment, and the opportunity to be able to work with some of that equipment that he had, like the limbus and the alter G, which we're going to get into in a bit, was just I would never have had that opportunity at other clinics. So kind of jumped at the chance to be able to learn about these products and really help other people understand it. So as part of my job as a clinical application specialist is to help educate people on what these technologies are and how it can help them in practice, and then help them understand how it can fit into their business as well. And really the aim of it is kind of like a secondary way of being able to help patients. So I still work clinically, but being able to help other businesses, physios, sports therapies, clinics around the UK invest in equipment, not only expand their business, but knowing that that's going to help their patients as well is just something that I really, really wanted to get involved in. So, and then obviously from just an educational perspective, I've learned so much in the time that I've been at Physiquipe, just by the people we work with and the people we've been in contact with. So it's a really good job that I really enjoy. But yeah, that's pretty much what I do on a day-to-day basis.
I mean, the two things I pick up straight away is, one of the things that I love about both of you is you're so passionate about it, aren't you? And I think that comes across, and you know, and it's lovely to see it. And that's why when we were chatting the other day, we had to get this on video, because it's like you're so passionate about helping people. And one of the things that I think it's more is not just about the products you're passionate about, but like Dominic, you said there, is, you know, actually getting the customers that you are, or the clinic owners that are actually buying the kit, making sure that they're making it successful and they understand it's all about. And I think that's a really, really important part. And I think really the nice things that I like about you, and why, you know, you were on here and we're trying to recommend you. So it would be, you know, we have to start with this, don't we? What are the products that you, because I mean, let's be totally honest, in the market at the moment in time, I only have to open my email box or my Facebook, and there's about 8 million products, you know, that are available to us as clinic owners. What are the ones that you've kind of honed in, and why would be a good question for me.
So yeah, just to address that, Andy, in that we want to be a screening service for someone like you, Andy, who's getting all these emails through. You've no idea what's any good. Is it reliable? Does it work? Is the company reliable who's providing it? So what we want to be more of a consultant to clinics like you, sports teams, universities, practices. And we can then, you would hopefully, if we're bringing it to you, you're actually going to look at it in the first place, but also we can relate as to how it's going to work, because we work with a lot of American products, Australia, Finland, they're all from very different systems. And still the Americans, for example, the healthcare system is so different. The way that it works there, it just does not correlate over here. So anything that we choose, we go through a long process of due diligence. Like we've just taken on a diagnostic ultrasound system, and that took me 6 months to look into, get feedback on. And that's quite a short time, I would say. For the Shockwave, that took a little bit longer. So we spend a load of time looking into these products and making sure that, for one, we like working with the company, we like the people involved, but then obviously the product has got to work as well. So that's kind of a general overview of what we're looking at in terms of the overall product. So we do a lot of work on that.
I think that's really reassuring, isn't it, as well? Because I think, it's good to know that anyone that does get in contact with you, and we're gonna talk about that later on, or does choose something for you, that there has been that due diligence done, that you're not just, you aren't just kind of going, oh, this, I can make a decent profit margin on this, this is fantastic. That actually what is more deeper than that is you actually care about the products you're delivering, does what it says it's going to do, so to the end user. So I think that's a really nice point.
Yeah, no, absolutely. So the main area in which we work in, so we work with various different products, but the main area is around soft tissue. So I mentioned diagnostic ultrasound, focused shockwave, which Dominic can go into a little bit more afterwards. We also work with instrument-assisted soft tissue mobilization. So it's the Hawk Grip system tools that we use. And we've also got a really cool product, which is it's a negative pressure. So it's targeted negative pressure. So it's got elements of cupping in there. That was actually one of the first systems which we took on, and it was being used in an orthopedic setting in the States. And a good friend of mine who I used to work with and now consults and supports us with training and introduces a lot of systems to us, just said it's a great system they use on all their post-op orthopedic patients for scarring and edema management. But it was actually used for lymphedema, which was not an area that I was familiar with at all, really. But that, because it was used so heavily in that area, that got us into that area, and that was actually an area where Dominic started. So with all of the equipment, sometimes it comes in from one angle, and then all of a sudden you're like, we're in a lymphedema world, or we're working with burns, or so it's quite random. But I mean, our main core area really is MSK, physio, private practices. That's where we really want to engage with people. But again, erectile dysfunction is another one that's come in with our shockwave system.
Yeah.
Got brilliant evidence in that area. So we've got the same system being used for in andrology as is being used at Premier League football teams and so on. So it's quite a diverse mix of things. And then we do work with some other bigger dynamometry, which is BTE, which is, I actually used to work with them at my former job. So I've been working with them for 13 years. And they produce functional dynamometry, and that equipment goes up to £100,000. So we've got a real range of things that we work with. But Dom can speak a bit more about the soft tissue products that we've got.
Yeah, I mean, to repeat what Andy said before about when we do our due diligence, like one of my jobs is to, like Andy mentioned, I challenge him on a lot of the things that he brings in, just from that clinical aspect. And obviously, Andy yourself as a physio, I like to be open-minded but skeptical, to welcome things in but question everything. And when I was first introduced to LymphoTouch, the targeted negative pressure system, and at first it's like cupping. It's just a gentle lifting of the tissue, but rather than it just sucking and holding, there was a little bit more going on. And when you first see it, you kind of go, is that really, is that doing what they're really saying it does? And then when you start looking into the research, the evidence, it's like an advanced lymphatic drainage technique. If you're looking at swelling and increasing blood circulation, or from an MSK perspective and scarring, we get those adhesions and restrictions that bind, rather than battering our thumbs as therapists or using quite compressive forces we tend to use. When it comes down to manual therapy, the LymphoTouch works the other way. So it actually lifts up, and it's a decompressive force, which patient after patient, time after time, you always see the relief in a patient, particularly with lower back pain and shoulder stiffness, anything like that. That sort of negative pressure really relieves that area. And then it's like that coupled with the instrument assisted stuff, the Hawk grips. Again, it's another tool that I kind of went, no, I've got my hands can do that. I'm fine. I don't need metal tools for that. And then after a week of working with them, you actually realise that there's so much more that just a simple metal tool can do to your hands. And I mean, on that point, we never say they're a replacement for hands, which is such cliche in the physiotherapy world and the massage world. I'm sure you've heard it a million times. It doesn't replace your hands. It's always an adjunct, and it's very much, it is the case. Hands are the best tools, but they have their limitations like any other product or technique. Everything has a limitation, and we need to be providing as many different things as possible for our patients, our clients, so that every patient that walks through the door gets a 5-star service of what they're getting, and they're getting access to this kind of thing. So that's where sort of the iStand was really useful, because it was able to hit areas that my hands just, you know, I've got a squidgy thumb, I've got my own pain threshold. Stainless steel tool is just going to get straight in, no problems. And then the shockwave came about, and we know, I mean, I'm sure you can cross shockwave plenty of times. I'm sure everybody's heard about shockwave. It's a massive thing. Loads of different variations of technology, and this was a real interesting area. And when it was described between radial and focused, they are, you know, I won't go into that, so that's a conversation for another day. But if people are interested, go and have a look at the differences.
We'll just do it next one. Be our next video. Don't worry.
Yeah.
We'll bring you on. We'll just have a big conversation on that. It's fine. Yeah.
Sure, because I mean, it's a really interesting area. But the focus shockwave, the really interesting part about that is your point of delivery was within the tissue. So everything that we did, whether it's with LymphaTouch or whether it's Hawk grips, was always from the surface of the skin, and it's transferring down into tissues. Whereas with the piezo wave that we have, it was able to get down to 10 millimeters in depth, 60 millimeters in depth. So we're able to target a specific area. And then that led us to get into the ultrasound, because the best practice that was considered was, well, if able to control the exact depth of what you're treating, then if you can see where it is, you can make your treatments even more efficient and also get the results. So, and the soft tissue work is definitely something in the MSK world that we work in. I mean, we've worked with several physios in the UK and around the world who are always saying that, you know, 99% of our patients that walk through the door are walking through with pain. And where is that pain? 9 times out of 10, that pain will be some soft tissue related. Even if there's a bone or a joint problem, there will be some soft tissue relation to it. So we can't just ignore that, and we have to still look at manual therapies. And like Andy said, all the equipment that we have, they're unique on their own, but they also work together really nicely as well. So you can offer a really nice package or build up your clinical services as well.
And I think that's the thing. I mean, you know, one of the things I took from that is that, you know, I think having a variability of services as a practice is always important, because, you know, one of my sayings, if you've ever been interested enough to listen to me present, that is the fact of, you know, we don't expect everyone to look the same when they walk in. So why do we treat everybody the same and act in the same way? You know, so, you know, everyone's needs are different. Everyone's expectations are different. Everybody's, you know, everyone comes in. So I think having I'm going to use this horrible analogy, I'm sorry, boys, but having more tools in your toolbox to deal with more people, sometimes, I don't know that, you know, that might be different. There's all different kinds of Hawk grip tools you can use if we want to go down that line. But I think the thing is that, you know, there's lots of different things. And I think having that choice as a practice owner or as a clinician, I think, and what definitely from what I've just got from that conversation is that that's the kind of things that you guys offer as well, don't you? But like you said, you can actually back it all up, which I think is really, really important as well in how to use it. So that's, you know, that's really nice to do. So I guess one of the things is, what would you say to, now with the conversations that we've been having with lots of physio owners, you know, while we're filming this, we're still in the middle of lockdown, therapy clinics are all starting to open up or considering to open up. And one of the questions that's been floating around, especially in our network and with the clinics that we support, is, you know, what are people going to do to the point of difference? You know, I would hope I've always been quite innovative in our business philosophy, and I've always thought I've been trying to be at the forefront of stuff. You know, I've made it very clear to Andy that my next purchase is going to be a diagnostic ultrasound scanner. That's definitely where I want to go with ours. It's on my bucket list. So one of the things that the conversation is, people are now looking, you know, what this time has given people is the time to analyze their businesses, focus on what they're doing and what they think they should do better. So where would you guys kind of then sit as to say, how would a practice owner who is looking to make a point of difference, say they are at the moment in time, like Dominic, you said, they are just hands, they've just got the thumbs and hands and that's their only tool. Where would people start, or where would they go to kind of help make their point of difference? How would you kind of advise them?
I mean, on the hands thing, if you're just a hands-on therapist, which is obviously where we've all pretty much started, is you know, people always look at the expense of equipment. I always just ask the question, how much do you value your hands? So from them as a clinician, how much do they value your hands? How much can your hands achieve versus whatever else? And I think when it comes to this point in time, when you can actually look at what service you've got and how can you differentiate yourself to other people, and we're seeing a little shift where I think patients are now looking more and more for private services. There are a few buzz things out there, but I think if you're offering more things and more solutions and more treatment options, then it means the more patients that are coming through your door, they get that amazing thing of, wow, they had this bit of kit, they had this amazing thing, they had this great, you know, 2 or 3 sessions, or even that very session, I felt miles better. Because I've been to clinics and you know, you look at some things and they're very limited in what they can offer. So it's like, you know, that to me says you're very limited in what you can achieve in some cases. And I know that could open up a world of conversation.
We like controversy, don't worry, go for it.
Yeah. So, but I think technology is, you know, something that we have to accept that is there, and it's very good. There is a lot of, all the stuff that we offer is evidence-based practice that is used in some of the biggest institutions in the UK and the world. So, and that these companies and private clinics have built massive businesses around our equipment that we use, which is again one of the reasons why we got involved with it. It's not just a great clinical outcome; it's actually the fact that you're able to build a business from it as well. So I think, yeah, if anybody's like looking to expand practice, it's like you have to look at technology. It's as simple as that.
Well, I think the big things, again, I'm going to back up with there. So yeah, I'm happy to join in your controversial discussion because that's where I sit as well with lots of things. So the 2 massive things I took from that is, one, if you're listening to this and you think a piece of equipment is expensive, you've got to look at your return on investment. You know, at the end of the day is, and I think my biggest thing with this and the reason why I wanted to have this chat with you is because I agree. I think the world is moving forward. I think, you know, let's look at Shockwave predominantly. It's become, you know, is it fair to say it's an in-trend or on-trend, especially tendon-related thing?
Yeah.
You know, we have a shockwaving clinic. You know, the outcomes we've got are fantastic. You know, the clinics that I work with around the UK and the world use Shockwave and are getting some pretty good clinical outcomes. We're now getting referrals into our business because we have a point of difference and we have one, you know. So I think there is an argument to say that actually what might look like an expensive piece of kit at one end of the section, when you actually put your business head on and go, right, I'll hold on a minute, we're a point of difference. We can get some good return on this, can't we? And I think that's how a lot of businesses have to consider. And if anyone watching this wondering how, then you can give either 3 of us a call, and we're quite happy to have that conversation, because, you know, I think it's something where if you are looking to invest in, it's the first thing you have to do, isn't it? You have to understand how is this going to improve my business? How am I going to get money from this?
Mm-hmm.
You know, and I think I agree with the private sector. I think more and more, you know, especially at the moment in time, the private physio sector is just going to be inundated, and I think people are expecting better and better service. You know, customer service at the moment in time. I mean, I was on a recent, bit of plug to me. I'm talking on Therapy Live about this, that the fact of at the moment in time, everyone is looking, because of COVID, is looking at their business and looking at how they can deliver their service best to their customers. Okay, purely because they have to be in a safe environment, PPE and all that kind of stuff. So for the first time, they're looking at how well they are serving. And I think from what you were saying there, Dominic, as well, is if people are honest, there's probably a lot more that they could be doing to provide a better clinical evidence-based practice.
Yeah. I think there's a few people.
If I can just add to that, Dom, sorry, I was going to say, I think that sometimes with that shockwave, that's become, I think you're definitely right, Andy, it's become a thing now, right? I get shockwave and I can get paid this amount for it. And I sort of question that sometimes. It's like, great, you get the referrals. That's like maybe taking insurance patients, or you're just kind of getting that sort of thing through. Whereas fundamentally, as clinicians, you guys are looking to get your patients back quicker. That's fundamentally why you got into the profession. Yeah. And it's like, of course, things have got to pay for themselves. But sometimes, like I've spoken with numerous people, it's like, well, we bought this piece of equipment. We had no idea how we're going to make it work. Or we tried it. It was amazing. We got patients quicker, better. And we thought we've got to make it work. And they've done really, really well for that. So we've got a system which is a multi-cervical unit, which is for neck pain. And there's very few of them in the UK. It's not a cheap piece of equipment. But we were speaking to a clinician in Australia, and she said she bought the system pretty much without really thinking about it, against what her business partner, who was her husband, but he was saying, just don't do it. And they've become such a kind of, because they marketed it well, they got loads of business in because they were offering something different. And she went with a passion, which, and I'm not saying that you should just be, and that's a 70 grand piece of equipment. So I'm not saying you should just do that. But sometimes you do have to actually look at it beyond saying, right, how much am I can do this, this, and this conveyor belt of shockwave treatments. That's not really what we want to do. And that's why we've not gone down the radial route. We looked at the focus route because it's a more expensive system, but the results we got were so spectacular with it. And everyone who's trialed it has had that. And that's from the top Premier League teams through to small one independent person private clinics have got the same system. So I think sometimes it's like we like to stay away from something that you just look at it purely on the return on it, because I don't know, that's just not the way that we look at it. Whether that's right or wrong, I don't know, but that's the way that we look at it. Is what if this system, does it work clinically? Does it add value? Does it make the patient better? Yes, then great. Like, sorry, Andy, was going to say about the diagnostic ultrasound. Even though we sell that, and we don't really have to do any sales pitch on that, people just want it and they're buying them. So our system's good and it's good price and it's good image quality, but sometimes we look and say, well, they're not prepared to invest on a LymphoTouch or Hawk grips, which are nowhere near as much, whereas they're looking at something which is purely diagnostic. So you sort of sometimes think, well, do you want something that's diagnostic over something that's actually going to make the patient feel better? Now, there's no right or wrong answer on that, but you could have a discussion around that one.
I think that's a nice thing with what you do, because I'm sure if anyone reaches out to you, and we know you're going to do that, and hopefully after this people do reach out and have those conversations. I think sometimes, especially in my experience, where they probably need to have that conversation with you guys, don't they? And turn around and go, what are you looking to achieve? What is actually you're looking to do? And I would argue on the return on investment that by you getting your patients better, quicker, faster to a better thing, that is a great return as well, isn't it? Because one of the big things no one gets upset with getting better quicker, do they? No one gets upset with getting better outcomes or faster outcomes. All they want to do is tell everybody else about that. So I think that the fact of that is that, you do focus on the end goal. And, like you say, we do have to also talk about money, because you've got to be able to pay for it. But I think you're right that fundamentally everything comes down. We wouldn't in my opinion, you wouldn't build a kit to make money on, you'd build a kit to get better outcomes. And if you chase the outcome, the money follows, if that's fair to say, doesn't it?
Yeah, absolutely.
So, it's really nice that you two have got that kind of moral standing, and that you stand that way, because that fits very much with what we promote as well, actively.
Yeah, I mean, morally, again, we're still a business. We still want to make as much money as we can, but we just think it's like we want to engage with people that want to engage with us on things. That's why I'm actually quite excited about the opportunities that this is going to present for us now, because we're doing a lot more online. We spend a lot of time traveling around to see customers, and sometimes it's like they just say, "Yeah, bring it in, show us it," and then we get there and it's just like, "Well, how much is that?" No chance. You've kind of like wasted a whole trip, and it's like, whereas now, hopefully, we can eradicate as much of that as possible.
Well, I think you would hope that, well, I don't know. I would hope that if you were going to look at a piece of kit, you'd research it before, waste your time. You need to be. Business tip, you should find them. you'd have a wasting time fee, just to at least travel on. But one of the things, again, that we have to kind of say, you know, I know that the passion comes across from the two of you, and I think it's great. But the other thing that I really love about what you do as a company is how you want to help and support the people that do buy from you. You know, for having somebody who's probably has bought kit and, you know, follow-up service is not the best, or pants, as we were talking off camera about, you know, one of the things I was, especially when I was talking to both of you off camera, was the fact of how much you care about how well the clinic does it. So do you want to just explore that for people listening, that if they were to buy a piece of kit, they're kind of not just left with it and left in the dark, what service you provide?
Yeah, I mean, I'll go into that, because I think that Dom does a lot of this, and it's challenging, really, because we want our customers to love the product. So obviously, in the first instance, they've spent a lot of money with us, they've bought it, so we want them to use it, we want them to get great results and continue to get great results from them. I mean, that's not just us being good people, it's also, if they use it, they like it, if they want more, obviously they're going to buy more from us, which is helpful, and then also they're going to speak to other people. So there's an element of that, but it is driven really by, people have spent money. We all know what it's like to spend a lot of money on something, and I would just hate to think that people have thought, what an awful investment, that was a terrible buy, and they were terrible to deal with. I personally would hate to deal with that, and I know that Dom and the other members of our team are exactly the same. We want to give a good service. I would sort of say, to some extent, we're too generous, really, and we have been way too generous with, like, Dom going out doing trainings. After the sale, it's not too bad, but a lot of the time we'll go out before they've bought something and supporting them more with things, which is just really costly. Is that money's got to come from somewhere. So again, maybe I'm being really overly optimistic, where now I'm envisaging like Zoom calls, Zoom trainings, and then if someone really needs it, then they're going to have to, they're going to really have to engage with us in terms of, yeah, right, come in, organise it, because the number of times we'll turn up in a place, or Dom will, and, oh yeah, no, I've got 10 minutes for you to do training, and he's just driven 4 hours to get there, and it's just sort of like, you know.
Well, which doesn't make, I mean, I don't know about your, you know, I don't get that, in the sense that, you know, you put in front of my team that, and they've got the opportunity to learn and be educated for 4 hours. They'd all sit there and absolutely lap it up. You know what I mean? They'd want 5 or 6. They wouldn't just want 10 minutes. So, you know, I think especially if you're passionate about helping other people, you know, you'd want the time. But I also agree that I think the world is turning. I think this world of being on Zoom is kind of going to, and realistically, do you not think it's just as good? Most of the training you can be done.
I do. Dom, what are your thoughts?
Yeah, I think so. I think, like, with like the Hawk grips, I mean, anybody who's like a manual therapist, they tend to pick it up pretty quickly. And as long as you're down with you know, as soon as you get the techniques, everything else comes in hand. There's a couple of things that might need a bit of physical support, but most of it is, once you understand what the equipment is doing and what structures and what the physiological responses are, then, you know, the penny drops and you're kind of like, right, I know how to use that. I know, because you know what it does, then you know how to apply it. And some of it just comes down to a handling thing. Is, you know, when we were learning, it's like, right, how do you actually position the patient? How do you know, orientate yourself around the patient to make it comfortable for everybody involved? And that's really the hardest part, which can take anywhere between 10 minutes to half an hour for somebody to figure out. And like something like the LymphaTouch, a training session in person usually takes around about 2 hours, whereas probably online would take about 45 minutes. So it's a lot more time efficient doing it online. Now, obviously, some people will still need some physical support, but we'd rather sort of do an online training, right? Go away and play, figure it out, you know, and because usually the learning curve is around about 2 weeks until people are really quite comfortable with it and go, right, yeah, I know how to use this now. And a lot of the time with the equipment, the hardest part is putting it on your first patient. It's just like, oh God, I've got the first patient. And I mean, going back to sort of any of the equipment before, it's a lot of people are in their comfort zone. So when it comes to the support, we understand that people are in their comfort zone, what they're currently doing, and investing in new equipment is pushing that boundary and pushing that barrier, which can kind of freak people out at times. And we want to be there to help people from an educational standpoint, and just say, look, we are here to help with materials, to help you as training materials, marketing materials. So you're not buying a bit of equipment and then that's it, you're on your own. You can use us as a resource to a certain degree, whether it's, I say, like these online calls are going to be so much easier to do rather than going in necessarily. Because that's the main thing. You want people to feel as comfortable as possible when investing in these kinds of equipment, new equipment, so that it will take time. So you have to be patient and you have to stick at it, but you don't want it to be taking too long. So we want to make sure, like Andy said, people are just away with it, they get it, and they're making the return, they can see the returns.
Yeah, I mean, anything new, isn't it? Any new skill, any new thing is unfamiliar at the start, and when we do any unfamiliar task, there's always a level of uncertainty and nervousness. But like you say, I think the fact that they know that, and especially it sounds like you're familiar at giving people that advice of how to become familiar, moving that pathway, and I think that's always reassuring as well, isn't it?
Yeah, and I think it's like with any new thing, it's, I say, open-minded, skeptical, and then when you come to learn how to use it, you've just got to dive in. You can't be timid. You've just got to go for it and understand that, with Hawker, it's like with anything, you might leave a little bruise, or somebody might go, oh, it's a little bit more sore, and you learn through, more experience. And when we have people that really engage with us, we engage a heck of a lot more with them, because it's like if somebody's really wanting to work with us and develop, then we're just thinking, well, that person really wants to develop their clinic. Well, we want to help you expand that as well, because like Andy said, if that means buying another bit of equipment, then that's a good investment of time for us. We want to make sure that if it was yourself that bought something, that you're raving off of it. So when you're speaking to your colleagues at a conference, then you said, oh yeah, you need to check out this bit of kit, and these guys are class as well, they'll sort you out with training. Because if it's not me, on the other occasion we do have international experts that come in, so there are opportunities that we get people from Australia, America, Germany, Finland, from different backgrounds in terms of cultures and countries, and see how they're doing it, and they can bring their experts to the people in the UK. So it's not just me, there's also people in the UK that we work with as well. So it's not just us, we want to try and bring other people in as well, so they can learn from some of the best minds around the world.
That's an absolute fantastic kind of link straight into the next section, which we're going to talk about the webinars that you run. We could have rehearsed this, could we? I tell you what, but because that's another thing that, I'm very familiar with the fact of, I think as a company, you do a lot of education stuff, don't you? And I think that you do provide a lot of that. And I think, most therapists, especially the ones I've met, love learning and love having to become, it's normally the team love the learning, and the boss then has to go and pay the bills. And so they're always the one that you have to convince. I know it's definitely in our company. So, do you want to talk about the little webinars? Because Dominic, you or whoever wants to answer this, on the basis that you talked about all these international speakers, but now they're all coming into webinar. Is that right?
Yeah, it is. So, I mean, that's another thing which it's been great for us already. We're starting to see the benefits of this. So we work with companies from all around the world, as I've said previously. And as Dom said, we've got speakers from Australia. It's a huge investment when we fly them over here. It costs us a load of money, obviously getting them in and then actually traveling around the UK. And also it's difficult for you, Andy, if you want to go to a conference, even if it's in Manchester, it can be a pain for you or whatever. So the webinars I'm really excited about, because we can now bring these people together. Like we had one the other day where we had someone in Australia, someone in Baltimore, and we were on chatting with them, and it's just straight away, it's really easy, really into it. It can be recorded. So we're going to be putting together, and we already are doing a number of webinars around all of the technologies that we've talked about. But again, we don't want it to be, it's not going to be sales pitches. It is purely talking about education. So we've been working with the Smug Group, Chris Myers, who runs that out of London. And he's a brilliant educator. And we started working with him just while lockdown started. And we ran several webinar series, and we were getting 500 people booked onto some of the ultrasound guided injections. And so we're going to be running a series with him, and that's going to become a regular format where we're going to run one a month with him. But we've also got other speakers around that area. And for us, really, we want to just bring the best clinicians and business people onto these calls. And really, we want to do it as minimal as possible. So we'll be involved to some extent in terms of adding maybe a UK angle to it, or our own business angle to it. But really, it's just like, how is this technology used? How does it work? What patients does it work on? What's the research? And then how do you make money from it if you're in private clinics, or professional sport? Obviously, that's not quite the same thing. But it's really just about bringing in and adding value to you as a physio, Andy. What is going to make you think, actually, yeah, we've got to buy this, rather than should we buy this?
And I think for that, one of the big things for me is I always think that we have to invest in our knowledge, because that makes us better clinicians, doesn't it? Do you know? One of the big things I've never understood as a, and I can't take my clinician hat wherever I sit. If I sit in my consultancy role, my clinician hat always sits on. And one of the things is, and I've always been, I guess, prided myself at being the top at the clinical, hopefully up to date with the best evidence-based I can be. So that when I am face-to-face with a customer or a patient, that I can turn around and go, right, actually, I know the best approach for you because I'm in tune with the best knowledge. Whereas if I haven't read a journal or I haven't been up to date, I mean, nowadays there is no excuses there for not being up to date in evidence-based practice, because, I remember doing my masters and sat in front of somebody and I was trying to tell them that the British Journal of Sports Medicine had gone onto Twitter, and I was told blatantly those kind of institutions would not go onto social media. And I was like, no, they're on it. And I remember showing her my Twitter feed, and she was like devastated that academia had gone online. And that were 9 years ago. Now you guys are, the education sits in our inbox. Do you know what I mean? We don't have to go and find it. It's all there. So actually, what you guys are doing is fantastic, because for most therapists that want to improve, the information's there. They've just got to sign up and turn up, haven't they?
Yeah. And I think with the webinars as well, I've been on quite a few during the lockdown period. It's like everybody's been doing it, which is brilliant. But one thing that we've sort of, Andy and I have discussed, and Andy touched on it there, is a lot of these webinars are product focused. And it's like, you're kind of on there for 45 to 60 minutes kind of going, I'm just being sold to it. It's just how good this bit of equipment is, or what this bit of equipment does. And we, yes, we're going to be talking around subjects that are pertinent to us and our equipment, but we want to be educating people. So take shockwave. It's like, how does it work? We're not going to talk about piezo wave. We're going to talk about shockwave, the differentiations, and how does it actually work, and what are the mechanisms of action and the different types of shockwave. So people can come away from these webinars going, I've actually learned something, and I can take something into practice. I think for people as well, there's less pressure, because I think having, even myself, even as a therapist, I'm still a sales rep, and it is quite a pressure scenario when, you kind of one-to-one with somebody that, if I'm speaking to you, I want you to buy the equipment, the defenses are up, and it's like, okay, I don't want to give away too much. Whereas behind the webinar, you make your own decision. There's nobody pressuring you. And I think being able to do that and offer more education and add more value to people will hopefully just help expand their practice as well. And they can make an unpressured decision on all of this stuff.
That would sit in my world of ethical selling, though. I'll be honest. That sits very much. It's not pushy. It's, look, here's all the science. Here's all the evidence. This is why it works. Oh, and by the way, if you do want to buy, this is where we are. And I think, and that's, for me, that's why you're on here, because I'll be totally honest. If you were pushy, I'd be absolutely hammered on my social media for having you on. So it's one of the things that, because you've got, and that's one of the things I said at the start. You're so passionate about helping people. You're so passionate about the products and the actual end user, not just the customer that buys from you, but actually John, who's the patient, and the outcomes they get. That's still very much driven. And it always has been, ever since I first met Andy. Flipping heck, it feels like 8 years ago, mate. So that's a positive thing, by the way. But do you know what I mean? I think that's the, and that's why, I couldn't recommend you, the company highly enough. I think it's fantastic. And I think if people are looking at doing this, should reach out. I'd definitely attend the webinar so you understand what they're about. I think one of the nice things is, to call it the Ron Seal. You are what you see, aren't you? I don't think there's no hidden graces. I've met you quite a few times and know, the whole philosophies behind what you're doing. So I would definitely, if you are looking to reach out to them. So if people are looking to reach out, how do they get hold of you?
So Physiquipe, so it's a bit of a mouthful, but we'll, I'm sure Andy will put that on the...
all the webinars and all the contact details will be below, but what's best? Is it just email or?
So yeah, email info@physiquipe.com. We're on social media, so all the mainstreams there. We've got our own Vimeo channel and YouTube where we've got a lot of our historic webinars, and they will be going on there as well. What I would say as well is that we're looking for, if any of this has resonated and people are looking at any of the technologies that we've mentioned, we're looking for regional ambassadors for these pieces of equipment where you would get discounted equipment, a lot more support, and for the benefit for us would be that we would maybe send clients into you. If they want a demo of shockwave ultrasound, they could come into your clinic and look at it. And again, we like doing it that way because, as Dom said, we're selling the equipment. But if you go and see the people that have bought it, they can give the good and bad points. We may not even be there. So if anyone is interested in being involved in that, if you're looking at any of this equipment, it's definitely worth doing because you're going to get cheaper equipment first and foremost. But yeah, in terms of contacts, email us info@physiquipe.com or dominic.smith and nandy.thomas.
Well, we'll add all that in at the bottom so people can contact you. Lads, thank you ever so much for your time. Honestly, it's been lovely. You know, I love the passion. I love what you're all about. So fantastic. And thanks very much for joining us in your time.
Thanks for inviting us.
Thank you.